and welcome to
Dr.
Brainwaves.
Brainwaves.
So once again, Dr. Azar and myself, Dr. Raschal, are going to be talking about another important topic. The reason why this topic is so important, and the topic is hypertension or high blood pressure, but the reason why it's so important is because even today, the number one killer in women is heart disease. And it frequently starts with an elevation in the blood pressure. So one of the things that we clearly know is that there are some steps that you can take to try and prevent yourself or your family members or your loved ones from developing heart disease. And so I'm going to have Dr. Azar talk about high blood pressure or hypertension.
Hypertension is, as people know, the condition of elevated blood pressure. And there are many definitions for that, and they kind of evolve and change over time, and they're a little bit variable between countries. But essentially, it's agreed upon that the blood pressure should not be elevated above 120 on the upper number or above 80 on the lower number. So I think it's really important for people to understand that most blood pressure elevation has unknown origin. We don't know why most people have elevated blood pressure. We don't know the exact cause for it. That is called essential hypertension. And that is the predominance of people who have elevated blood pressure. I think another important thing for people to know is that elevated blood pressure is generally asymptomatic. So most people don't know they have it. Some symptoms that you can get with it might be headache, flushing. When you have later stages, you might develop some shortness of breath, chest pressure, signs that you have visual damage from it, believe it or not. So a very important principle with elevated blood pressure is that even though it is asymptomatic, it needs to be treated. So that is one of the silent killers that gets detected when people go to see their doctor for a general checkup. They might feel like everything's fine, but that is one of the disease processes we as physicians hope to pick up on a physical examination and benefit patients by finding something that they're not aware that they have. So people probably know in general that it does tend to be something that has a hereditary tendency, meaning it does tend to run in families, but there are also some other contributing factors to high blood pressure. Obesity, diabetes, elevated cholesterol are all factors that contribute to your tendency to have elevated blood pressure, in addition to smoking, which is a habit type thing. And these conditions need to be treated as well. So high blood pressure is a problem because it can cause problems to organs in your body that are affected by the fact that they're constantly having a high pressure of blood flow running through them. It's kind of like if you look at plumbing in your house, if you have an area that has a high water pressure, it's going to do some damage potentially to some of the equipment that it runs through. So our bodies are about the same.
And question for you, with high blood pressure, is it always dangerous?
It is not always dangerous. We certainly know people that have lived their whole lives and had high blood pressure and were not aware of it and don't have any obvious damage to any other parts of their body. The most common areas that get damaged from high blood pressure are the head, the brain, the heart, the eyes, and the kidneys. Those are all areas with a lot of blood flow to them, and they can get damaged when you have chronic high blood pressure, whether you have symptoms or not. So,
do you think, is that the reason why when I go to the doctor or anybody goes to the doctor's appointment, one of the first things that they do is check your blood pressure?
Absolutely. Absolutely. That's a reflection of the fact that we're looking for some type of illnesses in the body that patients are not aware of. And it's important to know that that's another reason why physicians will kind of harass their patients about getting other things treated. There are what we call compounding illnesses. So if you have high blood pressure, we know for a fact that those other factors that I mentioned will compound or worsen the impact of that high blood pressure on the organs that can be damaged by the high blood pressure. So if you are heavy, you smoke, you have diabetes or elevated cholesterol, those are all things that will make the effect of the high blood pressure in your body even worse. So that's why we like to treat those other conditions at the same time. And of course, you know, a lot of those are not very evident either. High cholesterol is something people do not usually have any symptoms from, and diabetes can be one as well. So we watch those things closely and try to treat them aggressively in somebody who has known high blood pressure. I think it's really important for patients to know also that sometimes they'll present to their doctor's office with extremely high blood pressure, which is generally considered to be above 180 on the upper number or 120 on the lower number. And oftentimes the doctor will say, you need to go to the emergency department. It's not because the doctor doesn't want to take care of you. It's because we recognize under conditions of extremely high blood pressure, people can get an emergent or an urgent situation that requires very intense monitoring, so that at that time of very high blood pressure, you're not getting some acute sudden changes in those end organs. Once again, the brain, the heart, the eyes, and the kidneys especially are all very critical for our well-being and can be damaged very abruptly in the presence of very high blood pressure.
There's a condition that people frequently will talk about, and when they go to the doctor's office in particular, it's called white coat syndrome. Now, for the most part, that is a completely benign or a not worrisome symptom, but people's blood pressure may become elevated when they're in a doctor's office, which is why they call it white coat syndrome. Mm-hmm. And when my patients come in and they have that, I tell them, well, what I have in front of me is an elevated blood pressure. You tell me that every time you come into a doctor's office, you have that situation. Well, then what I want you to do is I want you to check your blood pressure when you're out of my office and record those numbers, so I have some confidence that you don't have high blood pressure all the time. And again, because Dr. Azar mentioned, it's completely asymptomatic. So a person will not have obvious symptoms. What we look at are those numbers. So don't get annoyed with your provider if they want you to check your blood pressure outside of the office to be sure that your numbers aren't elevated, because an elevation in your numbers can be an issue. There are some other conditions that can raise your blood pressure that can be regulated or easily treated. For an example, there are some medicines, decongestants for one, are ones that can elevate your blood pressure. And once you come off of those decongestants, your blood pressure should stabilize, go back to normal. And so there are things that can be done, but the key is to recognize A, that the blood pressure is elevated, and then B, what's causing it to be elevated, if we can figure that out, and then C, treating it.
So sometimes, and actually most often, we don't know exactly what causes high blood pressure. There are certain situations where we know somebody might be at higher risk for having an identifiable secondary cause. So when somebody presents with a hypertension that's significant at less than 40 years of age, or if somebody has a sudden change in their blood pressure, or if somebody has what we call resistant blood pressure. And resistant blood pressure elevation is blood pressure that is high even with 3 or 4 medications on board. Particularly 3 at maximum levels or 4 or more. Those are situations where somebody has a blood pressure that is atypically abnormal, and we might want to look for secondary causes, which might include tumors of the adrenal gland or elsewhere in the body called a pheochromocytoma. Mm-hmm. It can also be kidney disease. There's a regulatory mechanism in our kidneys that has a big influence on our blood pressure. So any kind of chronic kidney disease, obstruction, meaning the kidneys are not able to empty out, things like that affect the kidney well-being can affect our blood pressure. It's not common, but it is possibly a source of high blood pressure that we can identify and that we need to separate out from the non-known or essential hypertension patients. And in addition to that, conditions of the thyroid or parathyroid organs in the neck can cause blood pressure elevation, which is treated differently than regular blood pressure, essential blood pressure elevation or hypertension. So those are situations where we look beyond and see if there's another source for the high blood pressure that might need additional type of treatment. The take-home message is, take high blood pressure seriously. If you're not symptomatic, do not be surprised, but understand that that chronic elevation of blood pressure can do some serious damage to organs, strokes, heart attacks, blindness, losing a kidney. Those are all very serious things that can occur seemingly out of nowhere if you've had asymptomatic blood pressure, and most elevated blood pressure is asymptomatic. And I'm going to do a myth buster here just really quickly. And that myth buster is, you don't get addicted to blood pressure medications. If you need them, you need them. So let your doctor take care of you. Let your provider identify and treat medical conditions that we know preserve your well-being. Thank you for your time.
I'm sorry, did you have a question?
No.
I was just going to say that there's a couple of things that also you need to keep in mind, and that is if the doc has you on a blood pressure medication, there are some side effects with some of those medications, so just be open with your doctor and let them know that you're having some side effects from it, because some patients will tell me that the side effects were worse than having uncontrolled blood pressure. But honestly, the association with uncontrolled blood pressure, just like we talked about regarding your heart, your eyes, your kidneys, and your brain, are issues that really need to be addressed, because it's awful to have a stroke when there's something you could have done to prevent it, or have a heart attack when there was something you could have done to prevent it. And then the other question I have is, how does exercise play a role in better control of blood pressure?
Well, as you probably would know, exercise helps to decrease pretty much all risk factors that are modifiable for patients, with the exception of smoking. In other words, exercise decreases heaviness, and obesity is directly related to high blood pressure. Exercise decreases blood sugar. Exercise decreases cholesterol. So exercise is absolutely wonderful and is helpful in reducing not only blood pressure, but also blood pressure related complications and other comorbid conditions. In other words, other disease processes are improved in the presence of exercise. So
what about food? Are there any diets that have been shown to be helpful when it comes to controlling blood pressure?
Absolutely. And we'll talk a little bit more about that when we talk about more specifically different agents that are used to treat blood pressure. But in certain situations, salt reduction diets are helpful in reducing blood pressure. So we'll talk about that. And I also want to say that there are some other modifiable behaviors that can help with blood pressure, which we'll talk about in a minute.
Excellent. And in terms of diet, the one diet that has been most widely studied is a Mediterranean diet, which has been shown to be extremely helpful when people have elevated blood pressure. So there are things that you can do even before you go or after you see your primary care doctor, and know that your provider, your primary care provider, may not have a lot of time to discuss all of these other issues, but that's where getting yourself educated and tuning in to our podcasts or our videos is going to be extremely helpful for you, because we're going to teach you some things that you can do to better control your blood pressure while you're being seen by your primary care provider.
Absolutely. Thank you for your time, and we'll be back.